Why? Because more than 8 million people die every year in Kenya. 6,000 people die every year. There have been efforts to ensure that tobacco growing is eliminated in the country. But what really is the picture of success? Should we eliminate complete growth of tobacco? And what is the alternative? That is the conversation we're having later on, because it has devastating effects, mostly on the younger generation. And they're here to speak for themselves, and the experts on the other side. But before I introduce them, let me set the context of this conversation, because earlier on, I spoke to Dr. Vinayak and Dr. William Maina. Here's what they have to say.
Every year we celebrate World No Tobacco Day on 31st of May. And the effort here is to show that the use of tobacco continues to be a global threat. It's killing more than 8 million people every year. We still have 1.3 billion tobacco users in the world. The tobacco industry is reinventing itself with new and novel products every day. So all that keeps the attention for tobacco control in the global community at the country level. Kenya, for example, was one of the first countries to ratify the FCTC. It has been a champion for the negotiation of the treaty, and even after the treaty has been adopted, it has taken a number of measures to implement so that tobacco use comes down. And it has already started to see the decline. And we really need countries like Kenya, not only in Africa but globally, to take that leadership to demonstrate that reducing tobacco use is good for health, is good for environment, is good for economy.
Tobacco farmers are very serious farmers. Two, they are cash crop farmers. They farm to get money. So when we identify a value chain that needs to be used as an alternative crop to tobacco, it must be a value chain that has a red market. It has to be a value chain that provides the farmer with equal or even more capital in terms of returns. So when we are looking at what needs to be done with farmers, what we have done in Kenya, in Migori, and in other countries, is to identify the farmers who are growing tobacco. And from that point, I look at their soil, the rainfall patterns, and identify what kind of other crops can do in that area. Then discussing with the farmers, we look at the gross margins for each of these crops. And then the farmer, working with the farmer through their participation, they pick on the crop that they have the capacity to produce. And then after that, working with the Ministry of Agriculture, the extension officers, we are now training farmers on modern methods of farming.
All right, this conversation begins right now. Let me introduce my guest from my farthest right. It's Lucas Mosenda, who's the CEC Agriculture in Migori County, because that's where the event is taking place. The World No Tobacco Day is being marked there. Thank you so much for making time. Next to Lucas is Frederick Omondi, who's a farmer himself. Thank you so much for making time. Dr. Adriana Blanco is there, Head of Secretariat WHO FCTC, which stands for Framework Convention on Tobacco Control. Thank you so much for making time. And Dorcas Kiptui, Head of Division of Tobacco Control at the Ministry of Health. Thank you very much for making time. And on my left, we have an audience of young people. They'll tell us what they think in terms of the growing of tobacco, because 8 million people die annually in the globe out of tobacco-related illnesses, and 6,000 of them die here in Kenya, most of them young people. But Dorcas, I'll start with you on this conversation. Back in 2004, Kenya made history, being the second country here after Norway to ratify and sign the WHO framework. What would you say has been achieved so far?
Thank you very much. Just to give the context, the Framework Convention on Tobacco Control is a global treaty that was negotiated under the auspices of the World Health Organization. And this agenda came into place because of the tobacco epidemic, which is a major risk factor for non-communicable diseases, and is harmful from the point of growing tobacco to the point of consumption, and also beyond that, it affects the environment. So tobacco has effects on health, on environment, on the society at large, on the economics at home, individual economics, and also in the household and in the country. And so countries, member states of the World Health Organization came together to negotiate a global treaty. That a global treaty is like an international law that member states of World Health Organization had to sign and ratify, and by doing so, they are committing to be obligated to implement its provisions. So Kenya was the second to sign and ratify on the same day. It was not the second country in the world, but it was the second country to sign, to show its commitment by signing and ratifying on the same day. And once you ratify a global treaty, it means you have obligated to implement it. And in Kenya, under the Constitution of 2010, any international treaty that Kenya ratifies becomes part of the Kenyan law. And for you to implement an international law, you have to domesticate it in your home country through a national legislation. So we have the Tobacco Control Act. Yeah. And this act is based on the provisions of the Framework Convention on Tobacco Control. And it has provisions for reduction of demand for tobacco products. It also has provisions to reduce supply of tobacco products. So among the demand reduction measures includes creating awareness generally of the effects of tobacco growing, tobacco consumption, and also exposure to tobacco smoke. Yeah. And also creating awareness to policymakers and legislators on why they need to legislate tobacco control. And so in Kenya, majority, over 80% of Kenyans are really aware of the effects of tobacco. So that is one of the achievements we have made. We have denormalized tobacco consumption in the community such that it's awkward to see someone consuming tobacco products, and it attracts a lot of attention. Unlike before, it was seen as if it was something charismatic or something like that. So there's a negative connotation to it. Also, we are working, the government has increased tax on tobacco products to make them less affordable, and to also tax them so that part of that tax goes into addressing the externalities or the effects of tobacco. We have also put packages of tobacco. We have put graphic health warnings to indicate to the public the content of tobacco products that are harmful, like nicotine, which is addictive, and also other cancer-causing agents. And also the government now, in this context of today, we have, the government has supported farmers to diversify to other alternative livelihoods. We have worked, the Ministry of Health and the Ministry of Agriculture has worked with World Health Organization, Food Agricultural Organization, and World Food Program to reduce supply of tobacco products.
All right.
We have also put in place accessible goods management system to prevent supply of illicit products from the supply side.
Okay. Dr. Diana, let me bring you in on this. You know, when a farmer is listening to us back at home, even if it is a tobacco farmer, why should they stop farming tobacco?
Well, thank you for the question, and thank you for having me. I think that there are many reasons. And I will begin for the one that is closer to my heart, that is the human part, okay? Tobacco farming is not a good way of living, and I was chatting with Frederick before entering here, and I confirm that here is the same. Usually, it's a very labor-intensive crop that demands that the whole family, sometimes including the kids, are working on the fields. They expose them to a lot of health risks. One that is specific of tobacco, that is the green leaf sickness, that is because of the intoxication with the nicotine from handling the leaves, but also the exposure to pesticides, because they need a lot of pesticides. It's a very fragile crop. Then in an environment when the industry provide all the supply, but then of course charge it at the end of the cycle, and it's also the industry who grade and who put the price to the leaf that he was, I want to use his example, he was producing, but it's the industry who say, no, this is grade not that good, okay, and they pay less. Yeah. So really it's a cycle of debt with very little winning for the family and for the community in general. Also, if we are working for ending the tobacco epidemic, with time, still we are not there, but the demand for the tobacco leaf will decrease. So we need to provide for the people who has a livelihood based on that. And the third thing that is what the Tobacco Day is more about is you can also solve another urgent problem of the population, that is the scarcity of food. Yeah. And many countries in Africa that are being targeted by the industry as growing countries, they will benefit much more to growing other things that can get even food for the family of the grower, but also for the whole community. So I think that at least these three, and of course, the fourth one is to comply with Article 17 of the convention, the Framework Convention on Tobacco Control.
So the legal requirements as well.
Yes, a legal requirement.
All right. Frederick, Dr. Adriana calls it the cycle of death. But walk us through your story. When did you start farming tobacco? At what point did you stop? And how did it affect your family?
I started farming tobacco in the year 2000. But farming tobacco in my family started as far as 1982 when I was still schooling. So I came in as a farmer in the year 2000 after I had completed school. So I've been planting it until the year 2020.
Yeah.
That is when I stopped farming.
Okay.
But I've been a farmer. So I switched off from farming tobacco to growing other crops, especially the nyota beans.
What made you stop?
The reason that made me stop, it was so laborious. And now if I do costing of producing tobacco, you end up at zero income. Most of the farmers take the gross income to be the profit because they don't calculate. But of late, when I started calculating, if I'm getting something from growing that tobacco, it is coming to zero.
Yeah.
It is so very much expensive. So if I compared it with growing other crops, I find that these crops have got some good income, and even the period in which you take to get the income, like let me take tobacco. You take the whole year in processing from the nursery to harvesting and then to the market. But when you come to nyota beans, it's only 2 months.
Yeah.
And then you complete, you get back the money.
Yeah.
So that is why I stopped. If I compare the income from tobacco and that one from nyota bean, the year nyota bean is higher.
How has this affected your family before you switched?
Before I switched, in fact, in the year 1999, my mother became sick. And when I took her to hospital, she was diagnosed with a lung problem. And the first question that I was asked by the doctor if she was smoking, of which she was not.
Yeah.
And then she passed away in the very, very year 2000. So what made her died is from the inhaling fumes that he was inhaling when curing, as well as when she was doing the sorting of tobacco.
Yeah.
Yeah.
So she was not this first primary smoker. She wasn't even a smoker.
She was not.
Okay.
Yes.
Let me bring in Lucas on this. And Lucas, even as we speak in your own county, there are some people who are still growing tobacco right now. What alternatives are you giving them so that they transition from tobacco growing to other crops?
Well, Trevor, I think first, the truth is this conversation around tobacco must and should bring the focus of the farmer, because, as you've rightly said, there are a number of farmers who have been dependent on tobacco farming. But as a government, as a county government of Migori, in partnership with WHO, the Ministry of Health, WFP, and other partners, we have walked a journey that does a number of things. First is demonstrating the negative effects of tobacco farming. Some of them have already been mentioned. Tobacco, you will notice, is highly dependent on wood fuel for curing it, and that obviously brings in other aspects of deforestation and climate change and stuff like that. There are also the other effects of the heavy chemical use that is involved in growing the crop. And even as we join the global efforts to try and reduce, the growing and even the consumption of tobacco, We have lined up a number of options and I'm proud to say that the farmers in Migori, the pilot that was started off about 2-3 years ago, there was so much interest that a number of farmers at the moment are switching off from tobacco to the production of Nyota beans. My brother here has already highlighted the benefits of Nyota beans as opposed to the growing of tobacco. But we also have other options within the county that we are looking at. One is that we are really promoting the production of sweet potatoes across the county. And we are investing hugely in terms of infrastructure, extension work, in terms of the seedlings that go with it, as well as a sweet potato processing plant that we are commissioning sometime next week, so that then farmers have a real alternative in terms of where they can be able to sell their sweet potatoes and make a living. We are also focused big time on promoting the production of sorghum across the county, especially in some of those areas that have challenges around climate, climate and shortages in terms of rainfall, including the low-lying areas of Nyatike. Yeah. So sorghum is right there. We are also promoting dairy farming across the county. And to this effect, we have made available, in-calf heifers that are being provided to farmers, but more importantly, the value addition aspect on the milk to make sure that farmers get better incomes from. So it's a wide range, it's a wide approach to it. Yeah. But by the end of the day, it's a journey that we have started. Eventually, we should be able to have options and alternatives for those who choose to drop out of farming tobacco. And there are quite a number, Trevor. Okay. The data that we have is that the trend is growing.
The trend is going down. Okay. Let me hear from the younger generation here who have the microphone. You have the microphone right there. Do this legislation against tobacco use affect you in any way? Do you understand why Dr. Adriana is calling this a cycle of death? Let's start from there. Please switch on your microphone first. Mike will help you with that. Yes.
Okay. I'm Morris Dibika.
Okay.
I'm a member of the Hope Youth Group.
The microphone is still not on. Let's see how fast we can get that on for you. Yes, start again.
Okay. I'm Morris Judika.
Okay.
I'm a member of the Hope Youth Group. And with tobacco, you can see it reduces the users among the youth as the production is cut low. And many youth are unable to get it. Yes.
So when you see the legislation, like maybe what Dorcas was talking about, graphic image warnings on packages of cigarettes, does that deter you from this?
Yes, because it tells more about the future, what the dangers of tobacco is. It puts more of reality into the smoker. Yeah. So the person who gets into smoking realizes what he's getting into and can decide what to do.
Okay. You can pass the microphone to her and start with your name, please, and tell us whether this message is getting to you. Do you understand why they're saying this is a cycle of death and why you need to stop? And what do you tell other younger people like yourselves?
Yes, thank you very much. My name is Elvina Majiwa. I'm a tobacco control champion associated with the Kenya Tobacco Control Alliance. And the question on the health warnings, they're very crucial. And we've seen that many times the tobacco industry neglects these health warnings, especially when with the novel products. That's the nicotine pouches with Velo, with brands like a Lift that was banned. But and they keep pushing the adverts using flavors. They're targeting us. Just the other day, they were using influencers to target us, and that's where we go wrong. But I appreciate that there've been strides made. We've banned shisha, and we're promoting a happy and healthy, youthful generation.
Okay. You have the microphone back there. Let me hear. We'll start with your name and tell us whether there's any more intervention that you feel should be put in place as a young person to make sure that this message gets home.
Okay, so thank you. I'm Samuel Nyapara from Den of Hope, courtesy of Kenya Tobacco Control Alliance. So I feel as the government should increase more tax on tobacco so that people won't get enough money to buy it. Yeah.
All right. Let me bring in Dorcas back on this conversation. Dorcas, is there any sort of more policies or legislation that needs to be put in place to further help the fight against tobacco farming?
Indeed, Kenya has made a lot of strides and efforts, but we still have a very big margin to increase tax. WHO recommendation is that for tax to be effective, it has to be 75%, at least 70% of the retail sale price, so that if you're selling at a price, 70% of it should be taxed, so the price will go high. You can imagine a packet of cigarette in Kenya is about 300 shillings. That's like about $3, less than $3. But in Europe, for example, a packet is at least 8 euros, which is over 1,000 shillings. So we still have a long way to go to make it unaffordable to young people particularly, and also the poor people who are the most vulnerable, and they are the ones who are targeted the most. The youth and poor people consume tobacco the most. So we still have a room to improve the tax and also improve the tax administration so that it is easy to administer, and it can, besides reducing tobacco consumption, it can reap more revenues for the government, which can be used to improve health and social well-being of the citizens. In addition, we need to increase the graphic health warnings, the size of the graphic health warnings, and including standardized packaging, which is a plain package without any advertising or promotional material in the packet, so that you make them standard, because the industry uses color, it uses different decorations or different markings in the product to see if one is safer than another or one is more cool than another. So if you make all the products standard, then the general public is not able to distinguish them and is not able to tell. And also to improve on regulation on product content, content disclosure, so that we know what is the content of these tobacco products, and also eliminate some of the contents or constituents that promote consumption, like flavors. Tobacco in itself is very harsh and very nasty, that the tobacco industry have to add flavors to make it palatable. And so it masks the harshness, it masks the stinky smell and taste of tobacco products. So by eliminating flavors, then you deter people from consuming, and you also motivate people who are using to quit using them.
Yeah.
Further is to strengthen the enforcement of the law across the country. And this is very important because we have relatively good laws. And good laws without enforcement is not helpful. So we plan, the ministry is going to work with the county governments through the Council of Governors to strengthen enforcement in the counties, so that the legislation can come into place to facilitate tobacco-free environments, tobacco-free societies, and also ensure that the business people and the public comply with the law.
Yeah.
So we need to do that and strengthen more the enforcement and the compliance.
All right. Dr. Adriana, even as you push for zero tobacco farming, how do you deal with the industry demand? Because it's going to keep pushing some more farmers to take on more land and put them under tobacco, because we know globally there's 3.5 million hectares being put under tobacco every year. How do you deal with that industry demand? What more needs to be put in place?
Well, the important thing for handling the industry demand is decreasing the demand for tobacco from the population, no? And that is what we try to do when we are trying to implement the Framework Convention. Basically, also we need to remember that the population is maybe decreasing the percentage of smoker, but still the population as a whole is increasing. So now we are just in the moment where the total number of smokers begin to decrease slowly, because before the prevalent, the percentage was coming down, but not necessarily the absolute number. Still, this will take a time, and that is why the conventions has complementary measures. You are working in the demand side reduction measures in order to decrease the demand, and also you want to prepare the supply side to not be affected. That's why I was saying before that we need to prepare, because changing livelihood is not one thing that is going to happen overnight. So that we need to do it with time, because still there is a lot of fear sometimes in the farmers, okay, to go to a new crop, because the appealing thing that I have heard from farmers in many countries is that they know that their crop will be bought. Okay, but it will be bought, as Frederick said, with a very small margin for the people. So when they begin to see that there are other crops that can also be bought, and there are many mechanisms that you could put in place. For example, all the countries has a procurement mechanism where they buy food for hospitals, for schools. So it's a way where you can create a system that one thing fits the other, let's say, and you can have a system that helps not only the farmers to keep on working, but also the government in implementing the demand. It's something that is going to happen over time. Yeah. It's not going to happen from one day to the other. And it will be, I think that the decrease will be time to the reconversion of all the farmers.
Okay. Frederick, compare for me when you used to grow tobacco and now. How much did you used to make then? And how much are you making now? And how has the industry treated tobacco farmers in your view? Because you've dealt with them before.
Okay. When I start with how the industry is treating farmers,
yeah,
the treatment is too harsh.
Okay. What did they used to do?
Too harsh.
Yeah.
When it comes to the market, they are locked. You are not allowed to complain.
Okay.
The market is not free. And therefore, farmers go because there's no alternative. Because usually when you are producing, you want a market. So people go there because they have a market, but not because they like it. So when other crops come in, and then the sources of buying are there, I think that will make people change from tobacco to other crops. Like, for example, when the Nyota beans was brought in the year 2020, it came with a market from the Farmers Market Alliance. We grew tobacco, the Nyota beans, and we were given a market from the World Food Program where we sold.
Yeah.
I think that one promoted the interest of farmers. And nowadays, we are selling to schools as well as to the hospitals. And because these Nyota beans, from the trainings that we have got from the Ministry of Agriculture and the Ministry for Health, they have explained to farmers the contents of that beans. It has got a lot of iron as well as zinc. And therefore, it does not interfere with the stomachs after you have eaten. So the major thing is the market.
Yeah.
If the market is there, then switching from tobacco to these other crops becomes very easy. Now, I answer the second question, what I've been getting. In fact, I've been calculating, and sometimes I've been telling other farmers that we are getting zero. I've compared what we get from 1 acre farm of tobacco and that one of Nyota. From tobacco, you get something like 20,000 if you leave out your family labor. But from the Nyota beans, which is within 2 months, you get 32,000 sellings.
Yeah.
So if you take this year 20,000 from tobacco and now you subdivide it for the 8 months that I say that it takes, you end up getting something like 2,000 per month for the whole family. But this 32,000 that you get from the Nyota is only for 2 months. So I think better Nyota beans to tobacco.
Is it true that some of the industry players put farmers under contracts so that you're beholden to them, that you just have to produce for them?
They are contracting farmers.
Okay.
Yes, they give you the inputs. And this input is too much.
Okay.
Like as at now, they give 4 bags of NPK fertilizer for 1 acre.
Okay.
And the CAN 2 bags, that is 6 bags.
Yeah.
Which is not equivalent. For 1 acre, a bag is enough, which means they are also trading with farmers on selling other commodities.
Yeah.
The inputs that they give farmers is more higher, which is draining money from the farmers. And this is one part that is making farmers to get zero.
So they give you the inputs which you still pay for at the end of it all?
Yes, you
so
pay.
It's not free?
It is not free, it is loan.
Why is it that some of the farmers who have been growing tobacco find it difficult to transition? What do they tell you when you tell them? Because what you're saying makes it very obvious that you should step away from tobacco growing and go into other crops. But why is it that there's some resistance? What do they tell you when you ask them to move to other crops?
Some resistance comes from ignorance.
Okay.
Which I said that they don't do the costing. So at the end of the market, they take that gross income to be the money that they've gotten. They don't calculate what they used as the input to calculate what they has remained to.
Yeah.
Maybe let me take, like they say, from an acre. At the maximum, you sell at 800 kg per acre. The minimum, the average price, the market price is 170. But if you look at the grading of the tobacco, the first price is selling at 239 sellings. But go to the market. The grade that they give farmers most is grade number 7, which is at 140 something. So if you work out the average market price, is 170. So if you multiply that one with 800, you get something like 130,000. So if you calculate the inputs that you put, you end up remaining with something like 20,000 for the whole period of the period that you use for farming.
Yeah. Okay. And Lucas, do you have extension officers or officers that are helping the farmers transition? Because what Frederick is raising is a very important factor, that sometimes it's just based on ignorance. They simply don't know. So how do you ensure that they know?
Trevor, yes, we have a large team of extension workers, and indeed, I'm happy some of the statistics that he is quoting, as a result of conversations and gross margin analysis that we have worked out together with the farmers. And therefore, I think one of the issues that we have raised is the question of, so with all this data and information that is available with farmers, why is it difficult for them to transition? And I think the simple question here is the fear of the unknown. You would imagine a household that has been in that for say 20, 30, 40 years, for them to be able to make that snap decision really takes courage, it takes effort. But we are here to really continue working and having conversations with the farmers on the gross margin so that they are able to compare. And I'm also happy to actually let the farmers in Migori and other counties that the Nyota bean that we are currently promoting has a very, very high market. There is a very immediate market from WFP, from the local schools, from the local marketing, because of the benefits that he has talked about. So in terms of market, I think no farmer should have the fear that might I grow the Nyota bean and then fail to get a market for it. But it is not just Nyota bean, just as I have said. We are promoting other options depending on the farmer's environment, the farmer's context. We have a number of options. But I also just have to say that, yes, we are doing the much we can. We have a long journey to go. And obviously, it is a call that there is need for concerted efforts with other players, other organizations that need to join into the conversation. We have demonstrated that options are possible, but to scale up those options from where the level at which we are currently to a level that you would say then accommodates all the farmers in all the tobacco growing counties, we have a journey to do, and we really, really need to work together with other partners and stakeholders out there.
Do you have a general data of how many people are growing tobacco in Migori and how many people have transitioned and how many still remain to be reached out to?
Well, Migori is actually the largest growing county in Kenya. The statistic we have for the entire farmer base in Kenya is about 36,000 farmers. Out of that 36,000 farmers, in the neighborhood of 20,000 of those farmers are actually within the county of Migori. This particular pilot started only 2 years ago, and therefore we still have some ground to cover.
Yeah.
But right now we have in the top of 2,000, 2,000 to 3,000 farmers or so who have joined, you know, the growing number of farmers who are opting out of tobacco. So you can see we have covered some good ground in the last 2 years, but we still have quite a bit to cover.
Okay. Let me bring back the young taxi, and yes, you have the microphone. Start with your name and tell me, what do the other young people tell you when you speak to them against tobacco products? What do they say?
My name is Dr. Amolo Nadab. I am a pharmacist by profession, and tobacco smoking and matters to do with non-communicable diseases are something that hit close to home. My first concern would be this, statistically speaking, and I would be open to be challenged if my data is out of date. Out of all the tobacco smokers, 95% make an attempt to stop. 95% globally of everybody who smokes has made at some point a subjective decision that they want to try and stop using the tobacco. Out of these 95%, only 5% are able to jump the line and move to the other side. So I have heard the policies and the good things that Dorcas has been discussing, and she has forgotten to mention maybe what are we doing to work with the people who are already afflicted. Okay, because as I have put it, it is not an easy thing to stop once you have started. Just to quick statistics, yes, from the CDC, WHO, and in conjunction with the Ministry of Health.
Yeah.
Dorcas has mentioned that we started putting in place measures to combat the tobacco epidemic, as Daktari is putting it, in 2004. Yet in 2014, the percentage of people that were dying from non-communicable diseases was 27%. 5 years later, the number skipped to 39%. So we're having a significant increase of deaths by non-communicable diseases. I'm talking hypertension, diabetes. In a span of 5 years, in fact, it is estimated that by the year 2030, we will be having 55% of all deaths in the country being attributed to non-communicable diseases.
Yeah.
And now to tie this to tobacco smoking, like if you are a smoker, there is a 30 to 40% higher likelihood of you getting hypertension or diabetes than somebody who does not smoke. Now the sad bit about all this is you do not have to be a direct smoker of tobacco. Most people actually get afflicted by being secondary and passive smokers of this.
Okay.
So it would be, I would feel very happy if while we are putting the policies in order to combat the use, the picking up of the using of tobacco, we should not leave the people who are already afflicted behind.
Okay. And that's an important conversation. I'll come to Dorcas and Adriana to address that, because that also deals on the demand side. But there's a microphone back there. Start with your name and let me know what your younger people you interact with, what do they tell you when you speak to them against using tobacco products? What do they say? Because there are some in the market now that are allegedly less lethal.
Mm-hmm. Well, thank you so much, Ombija. And I want to first of all commend the entire panel, Mr. Frederick Omondi, for actually taking that brave action, the good doctor, and our madam from the government. Thank you for always representing us, and the County of Migori for the good work that they're doing. So one of the key things that always comes out is that we are always set aside. Young people are always set aside because the question that I actually wanted to ask is, what's the role of the youth when it comes to the policy-making process? Creation of awareness is not enough. We cannot just do that. Creating awareness, being aware about something, that is one thing, but understanding it is another. So these people are using different tactics to get to the youths. They know that we're energetic, we like experimenting, we're in that stage, so they take advantage of that. But the beauty about young people is that they have the ability to learn, to unlearn, and to relearn things. So the only thing that keeps on dissuading them and for them to be in that platform is that they are not given that opportunity. So one of the key things and one of the key intervention, which I actually wanted to ask is, in any court settings or conflict, there's always two or more conflicting parties. So there's the victim, there's the perpetrator. So in this case, one of the key stakeholders whom I expected to be in the panelist are these companies that produce tobacco. The moment that we have them there and the moment that we have one of us, the youths, in this panel is when we start having real conversation. Thank you.
Okay, brilliant. That's why I have all the youths here, quite a number of them, because they couldn't fit all of them on the same panel. But that's the conversation we're having right after the break. Let's take that quick break. When we come back, there's questions for Dorcas and Dr. Diana to answer, and then we'll also take some of your feedback coming through at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. We're back in just a bit.